Good afternoon, everyone. Hello, my name is Stephanie Mercado. I'm the CEO of NAHQ. Um, I want to get my frames organized here and we're going to get going. All right. Um, Here with me today is uh, both Patty Resnick, who is the president of NAHQ's board of directors, and Jennifer Pitts, who is the VP of programs, products, and certification at NAHQ. Insider Live is an event that we host throughout the year that is really designed to bring our quality community or our Q community together to talk about what is most important and what is highly topical at the moment. Our agenda today will be covering three important things. First of all, we will be talking about healthcare quality and the safety landscape. We're going to have a discussion about the role of the professional associations, especially in times like this, and especially your association, which is NAHQ, and clearing the path for you with tools and tips to make sure that you are positioned to thrive in this dynamic environment. So, as you are all experiencing, the landscape is really, really shifting. And at NAHQ, we've been monitoring these changes for years. If you've kept up with us at NAHQ Next and the written and other video presence that we've been having, we've been talking about the pace and pressures that are increasing. We've been talking about workforce shortages. We've been talking about AI implementations and the quality and safety challenges associated with those. We've been discussing regulatory changes, care changes, capacity issues. The list really goes on. And today we are experiencing more urgency and more intensity across all of these topics. And I know that can feel overwhelming. So the NAHQ team at our headquarters, we talk a lot about these topics, not only because it's our job to get our arms around all of these issues, but because it is our opportunity and our obligation to lead through them. So as the organization that leads quality and safety, I encourage my NAHQ team at headquarters, and I encourage the industry via our membership and CPHQs and others of you who are on the call today to really look at the changes that we are experiencing as opportunities and to really lean in to those opportunities. When I reflect on my 10 years at NAHQ, I am well aware that we have been sort of fighting the good fight and working hard to get quality to have a seat at the table. And we've been wanting our voices to be heard, and we've made a lot of progress in making them heard. But I think that today's pressures, as challenging as they may be, present really the ultimate opportunity to advance quality and safety as a business strategy. The path forward makes quality an imperative. We are not going to be able to achieve the ambitions that are set out before us or address the challenges that are ahead of us without focus on things like capacity management, utilization management, efficiencies, effectiveness, patient safety, and bottom line results. What can set the industry up for success is quality, and who can get us there is you. So before we dive into the content, I want to take a moment to address a topic that I know is top of mind for everyone, and that is today's social and political climate. Patty Resnick, NAHQ's board chair, and I talk about this a lot because we are responsible for leading an organization and an industry that is somewhat divided. Patty and I agree, left or right or middle of the road, everyone has an opinion, and we honor all of those perspectives. That being said, NAHQ is an organization that will not register opinions and will not make any judgments about environmental factors. You will not see us taking political positions because it's just not our role. We are not an advocacy organization, and that is not consistent with our tax exempt purpose. We're an organization that's laser focused on advancing quality and safety, and we are laser focused on supporting the workforce and the profession that is leading that work. So as the organization that's leading quality and leading the industry, we're going to do our best to be non-political and nonpartisan. We're going to use our quality tools and we're going to use our quality principles to state facts of the matter and to navigate change and environmental factors without judgment in any direction. We're going to lead with quality. So now I have the opportunity to turn it over to Jen, who is going to share some NAHQ research.
Great, thanks, Stephanie. So good news, NAHQ is here, as Stephanie said, to help you sort through all of this news, all of the noise, all of the valuable information, and maybe some of the not so valuable speculation that's going on, and help you sort it out and figure out what's going to be most important to you as you continue the great work that you all do. So the first slide I want to show you is our media news reporting and related to the healthcare landscape. So as you can see, this is these are the cliff notes. So let me give you a couple cliff notes. As you can see, this shows a very wide range, but as no surprise, one of the hottest topics is, and the one that's most emphasized in our research in the news right now, is the federal agency changes. And again, no surprise. After that, we see value-based care, which I think continues to be a very big focus. And I think something that we've talked about here at NAHQ headquarters as very positive, that this is still getting a lot of really great news coverage in this kind of messy cycle that we're all in right now. There's also a number 3 there is increasing stories of AI and technology, telehealth policies. So again, not surprising because there's been a lot of exciting things happening in this area, and a lot of things that we're continuing to watch out for. And I think the fourth one on the list, as we think about what's in the news right now, is workforce. And this is good for us because NAHQ has been talking about workforce development in quality and safety for a really long time. And so considering, again, all the things that are going on, having this continue to be in the news and get attention is really good for us here at NAHQ and all of you. So it's a lot to take in, right? I know. And depending on the day and the headline, you might be thinking, oh, well, I see progress. I see good news. I'm feeling optimistic. Lots of good things that could potentially be in the headlines. Here's some examples of those optimistic headlines I know I've been reading about. On other days, though, you might actually be feeling like, oh gosh, we might be doomed. Healthcare is in really, really big trouble. What are we going to do? And then if you're like me, I think about both of those things and everything all the time, and everything in between. But like I said, it's a lot coming at us. It feels like a lot of change. But again, I think that's why we turn to our associations and turn to our professional groups, because we do want those professional homes to help us sort out sort of what's going on. So that's the news and the media. The other thing that we're monitoring here at NAHQ and the landscape in healthcare is on social media. So we know, along with obviously checking our news feeds and all those media headlines, we turn to social media to get information and to kind of hear what people are talking about, their thoughts and feelings, and just to start to feel a part of the community. So we did some research internally to see what's trending on social media over the last year. So I should say since the beginning of this year, what people have been discussing on quality and safety. So there's a couple findings here. This is a word cloud. We like to do word clouds here at NAHQ for a visual, but some of the things that are trending on topics are, again, issues related to the administration. AI is coming up a lot. Some interesting conversations in social media about cybersecurity and some of the things that hospitals are going through right now related to data breaches and such. Misinformation, we still see conversations around shortages, burnouts. All of those are playing out in the conversation. I would say great news for all of you who are here and planning to come to NAHQ next. This information that we're gathering is helping us to really help us pick topics and all the most relevant content for NAHQ Next this year. So we're excited to bring you all of that. In addition to that, we dug in a little deeper and analyzed some social conversations specifically around impacts of the new administration. And again, we did a word cloud here, and we identified some of the top topics of conversations around changing policies, things around changes to equity, seeing in the news quite a bit and in social media, along with budget cuts, Medicaid, and so much more.
So these topics should be very familiar to you. I know that you're all reading the same news that we are, looking at the same similar social channels. And as a professional association, we are really here to help you navigate all of this. We are here to be out front of these issues, and I spend a lot of time at conferences and in conversations, as does Patty and other leaders at NAHQ, so that we can really keep our finger on the pulse of what is happening out there. Not only that, when we're doing that, we're really advocating for quality and advocating for people who work in quality. So I wanted to tell you about an opportunity I recently had, both to speak at a conference and to attend a conference. It was a really interesting event. The event was called Health Evolution, and the CMS administrator, our new administrator, Dr. Mehmet Oz, had his first public appearance there. NAHQ supports quality, and as you all know, a lot of the quality agenda in the United States, a healthcare system, is driven out of CMS. So I was all ears for what he would have to say. So at this event, the administrator focused on two things that I just would like to call your attention to. Those two things are quality and value. So in the conversation, not only at this event, but in the mainstream news and the media that you're seeing, if you're picking up on those conversations, we're hearing a lot of conversation coming out of the administration and from Dr. Oz about quality and value. In the conversation that he was having at this event, I think he mentioned quality at least 6 times in 45 minutes. And it became really clear to me that he understood the risk of a false choice between quality and cost cutting, and that he really understood that there was an opportunity to make progress on both. And NAHQ believes that we can make progress on both as well. The administrator, excuse me, also spoke about value. And as I mentioned, also this week, he has been on the media circuit talking about this. And we think that this is a big opportunity to advance quality and quality professionals like you, because quality and cost is the value equation. And the spirit that we want to project is really taking advantage of the opportunities to have an impact and make healthcare better. And we think that we have a really powerful story to tell the administration about how NAHQ and about how you are driving the quality, safety, and value agenda. So speaking of that, not only was it great news that I got to hear some of that perspective, but just after the session with the administrator, I had the wonderful opportunity of leading and moderating a panel that included leaders in healthcare. The topic of the panel was workforce and transformation, with a key underpinning around quality and safety. I was joined on the panel, sort of left to right here, by Ken Young, who's the president and CEO of MedDecision, Rashu Sarisa, who is the chief innovation officer at Advocate Health, and Ted DeWeese, who's the CEO of Johns Hopkins. We talked about really critical issues at that event, about building capacity for quality, about building capabilities for quality and safety, and how both in the short term and in the long term, how we are going to really advance high quality, safe, sustainable systems. These are, big leaders with big visions and who are really committed to making sure that we are working through some of the challenges that are ahead of us across a variety of topics. And not only did I have the opportunity to speak with the leaders and have a dialogue about advancing quality and safety, but there were a lot of leaders in the audience listening to us. And caught my eye, two individuals that caught my eye were John Perlin, who is the CEO of the Joint Commission, and also the CEO of Sutter Health, and his team were in the room, along with many, many other leaders. And it was really wonderful to not only be interacting with the panel, but to be having other leaders listening to us and listening to them and understanding where we need to be taking quality and safety and workforce in the future. Also, just to mention so that you're aware of more of the work that we're doing to spread the messages and the mission at NAHQ is some opportunities that we took advantage of with HFMA in New York just this spring. I had the opportunity to moderate a panel that included quality leaders, leaders from the Joint Commission, also who were, and a CEO who happens to be one of our board members. The CEO of Stony Brook Hospital was on the panel as well. And we talked about quality and safety and value and how quality can be a key business strategy. And coming up next month, I'm going to hit the road again. I will be attending and presenting as a panelist at the Modern Healthcare event focused on patient engagement. So we are out there all the time. Patty is speaking. I am speaking. We are out there making sure our mission is known, your good work is known, and that we are leading with quality. It's also very important for us at NAHQ to make sure we are hearing directly from you. You are valued in the community. You have valuable perspectives, wonderful insights, and we try and get those from you as much as we possibly can. So when you all registered for this event, you were invited to share some questions and some topics that you hoped we would address today. And I can tell you, as far as this word cloud goes, there were a lot of topics that you were interested in, and those are represented here. But the team here at headquarters did a great job of narrowing down those topics to about 5 core areas that we are going to address with you here today. So some of those will include impact of the new administration, overcoming challenges and navigating change, a conversation about how to do more with less, how to make the business case for quality. And a lot of people were wanting tools, resources, things they could activate where they work to navigate this change. So we are going to be including that as well. So now we're going to do some Q&A. We are I am inviting Patty Resnick and Jen Pitts back into the conversation, and Jen is going to moderate this Q&A, and also we'll be picking up some questions from the attendees that are joining us today. So some of this is sort of structured and planned out so that we could get to the questions that you submitted ahead of time, and some of it will not be. So please feel free to write questions or comments into the chat, and we'll Jen will do her best to sort of navigate both of those things. So Jen, it's up to you
All
now.
right.
Take us away.
All right. Thanks, Stephanie. All right. So let's get started. So Stephanie, you've been out there. You shared some of the work that you're doing, talking to different leaders about making an impact and how the new administration is potentially, making impact on quality and safety. Can you share above and beyond what you've already done, share a little bit what else you've been hearing and your insights into all of this?
Sure. There are many. And, we
Yeah.
do have time box on some of these things, but what I would share overall and what I'm really channeling right now in my own role as the CEO of NAHQ and my own leadership is really trying to balance the fact that we are all adapting to a lot of change going on in the environment. Like we said, a lot of that it was already on path. Some new things are coming into the mix. Certain things are being accelerated, others things pulled back. It's a lot to adapt to, but I think the thing that I'm really taking away, and I'd say following the lead of some of the most senior and seasoned leaders in the industry, I'm seeing them try to take some of this in stride. And I am trying to take some of this in stride. I think that it's really important to not just react to all of these things because we would, maybe feel like we're playing whack-a-mole trying to, cover the bases and address all the issues that are ahead of us. But instead, focus on planning. focus on maneuvering, focus on leading. I think it's really important, as much as it's important to keep up with the news, and I do that, and NAHQ does that. Um, it's important not to get caught up in a news cycle. And I think it is very important to make sure that we're relying on our trusted advisors. We're looking directly to CMS for insights and direction, instead of speculating about what may or may not happen. And here at NAHQ headquarters, I've encouraged the team to not get distracted. We have a mission. We have a focus on quality and safety, just like all of you do, where you work. And I think it's really, really important to do that. I think also too, we have to acknowledge the reality that some people are getting nervous. Especially on the finance side of things. We know that healthcare financing is challenged at the moment, and a lot of the spending on some things that people think are very necessary, that we think are very necessary, around workforce development and advancing a quality and safety agenda. Some of those things are slowing down. I think it is just that. I think it is a slowdown. I do not think it is a stop. I think people are just, taking inventory of what's going on and finding a way forward to proceed. And that's why I wrote about a month ago an op-ed about false choices. I don't believe that we have to choose between high quality, safe care and affordable care. I think that we can advance quality and safety objectives and finance objectives at the same time. And in fact, if we lead with quality, we can do better on quality, safety, and finance all at the same time. And we have a lot of data that backs this up, and really great case examples, which I think I'll have an opportunity to speak to you about organizations who are using quality as a business strategy and winning.
Thanks, Stephanie. Yes, don't worry. We'll get to the tools and resources section of all this, because if you haven't seen that op-ed piece, we definitely want to check it out. So Patty, what are you seeing and hearing from your vantage point?
Yeah, thanks, Jen, and thanks, Stephanie, for such a really detailed overview of your thoughts and what you're seeing out in the environment. So as I network with healthcare quality professionals, and I spend a lot of time in case management and and on the revenue cycle side, what I'm hearing is the pressures that are being felt in operations, from cost cutting, position freezes, asking to be able to consume more work with less resources. And in that kind of environment, it's super important to be more efficient and effective. And a great way to do that is through professional development, workforce development. I'm also hearing a lot of people are very focused on the rapid pace of change. So not being just getting handle on one change, and there's multiple changes being made. And I think that in this environment, it's really important to be prepared and anticipate what changes may be coming. And just some tips on how to do that. CMS has set their priorities. There are 8 priorities. Familiarize yourself with those priorities and think about how might there be changes coming down to your particular role or organization based on those priorities. CMS has also released the proposed rules across the continuum of care. These are great ways to prepare for what might be finalized at the end of the year. Now, I'm not advocating that you read the 1,500 pages of the Federal Register, but what is really nice is they do put out fact sheets. So if you Google the CMS fact sheets for the proposed rules, you will find very succinctly listed what the priorities are and what may be coming down later this year. So this can help you prepare for, wow, if that change gets enacted, how are we going to handle that with the resources that we have? It might not get enacted, but better to be prepared in case it is. So there's some of the things that I'm hearing, and I think the best way to handle that is preparation and really in investing in your own professional development or in the development of your workforce.
Great. Thanks, Patty. Awesome tips. I love it. So we've been talking, so I know there's a category around making the business case of quality. This isn't new for us here at NAHQ. We've been working hard to do that. And as obviously a result of all of these, finding efficiencies and cutting costs and everything we've been talking about, this is becoming more and more important. So Stephanie, what can you tell us about how to quantify how important quality is to an organization, in an organization? What advice would you give people?
Yeah, thank you for the question. I'm gonna take that in two parts, if I might. So the first part is what I want to explain and sort of help everyone understand about some of the things that we've done, some of the building blocks that gets us to be able to quantify the ROI of quality. And that is for us really rooted in some of the activities that we are activating with organizations like Christus Health, like Kaiser Permanente Northern California, like the Veterans Health Administration. Those organizations have been partnering with NAHQ to really identify ways to advance the competencies and skills of their individuals, to advance strong teamwork between those individuals, and to really do more with less, and really develop their people in the process. We have seen organizations that are working through our programs. Our program is called the Workforce Accelerator. They are delivering ROI beyond our wildest expectations. Actually, I was working with Claire from Christus on her case study recently, and Claire is doing a beautiful job of articulating how an investment in quality and safety can produce results, for example, and including a 50% reduction in serious safety events. She is also citing a return on investment and also improved results against their pay for performance models. And she is seeing $15 to $20 million in annual gains in those programs. And I think that what is really compelling about that is that she's able to take that data. She sees the data, you all see the data, you're looking at reports and analytics all the time, monitoring progress towards your goals. And that is really important. But the step beyond that is really turning that into the business case, making the case for quality, making sure that your leaders understand the full circle result that they are achieving because of the programs that you are implementing, because of the programs like Claire and VHA and KP and Columbus Regional and King's Daughter and many others are working on with NAHQ. So quantifying the impact is critically important, and we would encourage you at every turn to do that more, to do that better, to do that faster, because it is a stressful time. I also would just add, I think that healthcare leaders are looking for new solutions. They're also looking to cut costs. And so if we are not making the case for quality, if we do not do that at headquarters, if you do not do that where you work, that's not going to position us well. And so our full focus is on making sure that there is a very big focus on ROIQ, which is the return on investment in quality. And we encourage you very much to do the same at your organization. And at the end of this, I know Jen's going to be mentioning, but we actually have some support resources and tools and some inspiration on how you might think about doing that.
Great. Thanks. Patty, do you have any additional examples on how to demonstrate ROIQ?
Sure. Thanks again, Stephanie, for the detailed response. And what I'll add to that is also be thinking of quality as a discipline, not necessarily as a department. Of course, there's quality departments to help drive that work, but every person in the organization has a role in quality. So when you're talking about the return on investment in quality, look at your role specifically, the role that your department plays, and understand the linkages to the revenue for the organization. So for example, I'll go back to the case management operations. Utilization management drives the financial success of the organization through the determination of the patient status. Is this an inpatient? Is this episode of care an outpatient? Not only does it drive the finances that way, but it also drives by that determination which quality program that episode of care may wind up in. So if the status is changed from inpatient to outpatient during the stay, that episode will end up in the OPPS, not the IPPS. Why is that important? It's important to have the structures and the processes in place so that you can make that connection between the work you do and how that drives the financial success of the organization. If you're making changes post-discharge in utilization management, you get into different scenarios, but one of those scenarios is if you have to do DRG downgrades, you're potentially losing money for the organization. So look at your individual role, qualities of discipline, and make the connection between how your operations or how your role individually drives that financial success for your organization.
Let me jump in on that too, Patty. I would mention as well that a way to help others see their role in quality is to utilize NAHQ's healthcare quality competency framework. We have that visualized in the form of a wheel. And that framework is becoming incredibly powerful tool in healthcare to help organize and orient people around a quality and safety agenda. And we have wonderful examples. One top of mind at the Veterans Health Administration. VHA has worked with NAHQ to implement the competency framework within all 18 VISNs. And in so doing, they're literally walking the wheel around their entire operations and all of meetings with their team and helping everyone understand how they play a role in quality. Christy Groves, who is leading that program along with others, are talking with the clinical front lines and helping them understand their role in quality and all of the care processes, care transitions, and how that affects exactly what you said, Patty, rev cycle and all of that. They are meeting with departments like the suicide prevention department and saying, how do you fit into quality, right? So it makes the framework really makes quality come to life and helps people understand their role so that as you are working, like you said, cross-functionally beyond just the quality department, but throughout everyone who's contributing to the discipline, that's a really good resource. And I would encourage you to take a look at that as well.
So that, Stephanie, interestingly enough, that sounds like if people are doing this successfully, that's a lot of change to manage, right? As we're thinking about getting more people to see themselves in quality. And I'm sure there's some great success stories about that. And I'm sure you're hearing this as a hot topic as well. What advice and insights can you offer about managing this type of change?
Yeah, so before I talk about the advice and insights, I want to mention just a story that I'd like to share with you. So I was in preparation for one of the panels that I was going to be leading this spring. I sat down with one of the panelists and we were talking about a program that he was implementing within healthcare organizations. He had a technology solution. And he had just signed the contract with one of a new client, and they went to the kickoff and they went to do the implementation of said solution. And he mentioned to me that during the first break, that the leader of the department that was initiating the program pulled him aside and said, I think we're going to have to pump the brakes on this. I don't think that we can continue with this. And he said, oh my gosh, what's wrong? I thought the kickoff was going great. I was feeling really good about it. what can I do to improve this and to continue down the path? And he said, the individual said, you know what, there's nothing really different than you could do. We need to do things different here at this hospital, this system, because we are not ready for this type of change. And so it wasn't the technology solution that was the challenge. It was the readiness for change in the organization. And I thought that that was just such an interesting and enlightening story to say, wow, all the stuff we're forcing into healthcare, is everybody really ready for this? Not really. And so, to your point, Jen, on change management and how to really think about that and adapt to it. So, first of all, I would say control yourself if you can't control the change, and try, even when it's hard, to make sure that you're working yourself through the change process. And when you need support for that, NAHQ is here to help. In fact, I was just speaking with our education team, and I was really excited to learn that they are hosting a series this summer. And I know, Jen, you know this well, about change management. So this is something that will be offered free to NAHQ members in a series to help people really prepare, not for the change themselves, but also to lead through it. Not only that, I'm really excited to announce that NAHQ is releasing in just in a couple of weeks, I think, another micro credential. So NAHQ is, I don't know if everyone knows this, but we have our CPHQ certification, which is our flagship certification, but we have also added micro credentials into the mix. And the micro credentials are based on the framework. They're based on each sort of the 8 slices of the wheel. And as part of the PPI micro credential, which is coming out in May, there's a big focus on change management. So our constituents can also find content embedded within that micro credential. So I think the name of the game is keep current, keep relevant, and prepare to grow. And I have a story for that, a very personal story that I'd like to share at the end of this presentation. I think time will allow for that, about growth and how to navigate yourself through some of these changes. It's been my personal inspiration. I want to share it with you.
Great. All right. The final block of questions that people came in had to do with doing more with less. So Patty, talk to us a little bit about, are there solutions available from NAHQ that you think can help?
I'm sure. And doing more with less, right? Always a tough challenge. And the first thing that I was always do here is, first of all, take a look at what I'm doing and figuring out if there's things I don't need to do any longer, of course. And then looking at the efficiency of the way of doing things. But most importantly, and top of mind, is investing in yourself. And if you're a leader in this space, investing in the development of your workforce. So from a personal perspective, invest in yourself. The Q is you. Invest in getting certified in healthcare quality. Not only will it raise your own personal competency, but it demonstrates to leaders your commitment to that excellence and standardization. And it also enables you and demonstrates that you're a lifelong learner through the continuing education process as you get re-credentialed. From a also from either a personal workforce development or an organizational workforce development, NAHQ has a broad platform of tools and resources at the ready. Stephanie talked about the competency framework and the self-assessment. There's the workforce accelerator. Stephanie mentioned organizations leveraging that tool very successfully. And then there are other things. Through your personal membership, you have access to learning labs. Certainly the premier conference is NAHQ Next, which is coming up in September. Always an agenda that is jam-packed with great topics and great speakers. And then there's organizational memberships as well. So as you're looking at doing more with less. It's important to prepare yourself and to prepare your workforce, enable one another to take on more with less as you look to do that efficiently and effectively.
Yeah, and Patty, I would just add to that as well that if everybody has not seen it, I'll just make a mention. A couple of years ago, NAHQ published a peer review paper in our journal. Our journal is called JHQ. All NAHQ members receive free access to that. And that paper confirmed that individuals who hold the CPHQ are operating at higher ends of the competency spectrum than their non-CPHQ peers. And so just to your point about being relevant, maintaining your currency, that is a huge demonstration. The CPHQ certification is a huge demonstration of that, made even more powerful by the recent endorsement of that certification and the competency framework by the Joint Commission. So I think most people have heard about that by now, but if not, last November, the Joint Commission did endorse NAHQ certification and our competency framework, which is a big signal to the industry that it matters, it's making a difference, and it's having an impact on patient safety and quality in healthcare.
So that's the end of our kind of questions and prepared blocks. It's interesting, I have a comment here from a member here who, talks about, in many developing countries that there's limited resources there, right? Limited resources, limited regulatory enforcement. And maybe, Stephanie, if we don't have an exact example from another country, but if I know we have a lot of individuals here who've worked with our resources that have limited resources and some much, much smaller healthcare systems here, the question is really around how can NAHQ's resources, particularly the healthcare quality competency framework, be maybe adapted or scaled to support quality transformation. And I wonder if you have any perspectives from some of the work that Christus and others have done to kind of maybe start small or, kind of do what you can as you're scaling up with some of these efforts.
Yeah. I think in particular, I see the question as well. I think this is one coming, especially from India is the reference. How do we support low middle income countries and getting the competencies put to work? A couple of things. I would say on a very practical level, reach out to us. We have a lot of content at foundational levels that may be a good fit to get your team started with learning, with some skilling, with some training. So you can reach out to our team. How about, I think someone from our team can put in the chat, Amy Laguai would be a great resource to help with that. So we can get you in touch with somebody who might be able to help you brainstorm about that. Additionally, I would say via our partnership and alliance with the Joint Commission, NAHQ is having discussions about how we can engage with them to support organizations who are in lower to middle income countries. So that is an early conversation, but we are very active and engaged in those conversations because we know that quality and safety is not just a US issue, this is a worldwide issue, and we want to make sure that we're supporting the world in advancing quality and safety.
Right. All right. Well, I think that might be the end. I don't see any other questions. So let's go to what we promised, right?
Jen,
do you see one more?
Jen, can I interrupt you? I'm sorry.
Oh, yeah,
I
sure.
see one other question. It's kind of way up in the chat, which is about, somebody was wanting the detailed skills statements. Yeah,
yep.
So NAHQ has, if we have just a minute, I'll take a moment to explain that.
Sure.
So NAHQ's competency framework sort of has three sort of layers. The first is our competency domains. Then we move into the competencies themselves. There are 29, soon to be 28, I think, but about 29 competencies. So 8 domains, 29 competencies. and then pulling out to about 486 skills. NAHQ publishes the domains and the competencies. We do not share the skills statements for a couple of reasons. Number one, one of our highest ambitions in healthcare is to make sure we are achieving alignment of the workforce. And when you put 486 of anything into the market, it can get a little messy. People start to use those skill statements to sort of hunt and peck and construct and deconstruct and put them together in ways that are not consistent with the model. And the integrity and fidelity of the competency framework is the most important thing, not just to NAHQ, but to actually advancing the profession. So we felt most comfortable putting into market the domain areas and the competencies. The way that individuals and organizations can consume skills, because we don't want to leave you out of that, right? But we want to make it consumable instead of just sort of pushing 486 skill statements into the market. It's all consumed through every piece of content that we offer. So when you attend NAHQ Next, for example, every session is organized against the framework. We identify the domain, we talk about the competencies, and the skills are baked into the learning objectives and all of the content. Same thing goes for our learning labs. The skills are integrated into those learning labs, so you're getting it within the process of consuming the content. Not only that, but as we work with Workforce Accelerator organizations who are working with us on Workforce Accelerator, KP, Christus, Columbus Regional, and many others, we help them integrate that into their system. And so we are working with them on developing very formal job descriptions, role profiles, performance standards. And so that's sort of a methodical and rhythmic way that we are getting that into market. But we do not just release that into market because, as I mentioned, it would actually sort of go against and probably fly in the face of all of the effort we've made to standardize. So please participate with us through the individual programs. That's how you'll consume it, or through the Workforce Accelerator program at your organization.
Thank you, Stephanie. Appreciate that. All right. So as promised, we are going to talk about some tools and resources that we've put together for all of you. We've looked at some of the things that we have available, and we wanted to curate all of that for everyone who attended today. We have some of those real world success stories that Stephanie mentioned, who are, going in and looking at change management and workforce development, changing culture. All of that is embedded in these amazing stories. We pulled together some thought leadership for you. So some of you have seen these pieces, but again, it's always good to kind of go back and refresh. As a learning person, you have to, see things like 7 times, I think, in order to retain it. So we're pulling together some of our best thought leadership on leveraging quality as a business strategy, and that false choice piece that Stephanie just did, which is amazing, has gotten great reviews. And then although we are obviously moving towards, creating content and an amazing 2025 NAHQ Next, we look back at the archives of our 24 stuff, and there's a really, really great relevant content there. So we pulled out a couple key sessions from 2024 NAHQ Next on leaders talking about cost and quality, and making the financial connection to those. So again, that business case, I think, is really important. There's a great session on becoming a quality champion. So again, we're going back and just pulling everything together in a nice, neat package for you. And as a follow-up to this session, be on the lookout tomorrow for an email, and it's going to have all the links to the resources. And we're confident that you'll find them very helpful. And again, it's just one of the other ways that we're here to help serve you and help serve the profession.
Great. Thank you, Jen. Appreciate that. So now I have a quick opportunity before we conclude to share a personal story. This is a story that I'd like to share because it brought me so much inspiration, and I'm hoping to share that inspiration with you. So earlier this month, I was at a yoga class. And I was feeling very out of shape. I was very tired and I was not feeling strong. I was actually feeling very, very weak at that exact point in time. I didn't want to be there. And I wondered if I could even make it through class. I thought how embarrassing it would be if I left, but that was a real possibility at that moment for me. I was struggling. So as I laid there in my child pose, I heard this chant and it spoke to me. So the chant goes like this: if you are unwilling to grow, no one can help you. But if you are determined to grow, no one can stop you. If you are unwilling to grow, no one can help you. But if you are determined to grow, no one can stop you. I really needed those words to power through my yoga class. And I made a commitment to myself at that point in time not to feel as tired and not to be weak. I decided to be strong that day. And so I'll share a personal accomplishment with you. Last Sunday, I celebrated my 12-week anniversary of activating strength building on a personal level. And so no matter what, I'm working out 5 days a week, removing barriers so that I can grow. And I'm sharing that with you, not so much so that you'll, keep track of my physical fitness, but really so that I can share this mantra with you, because this mantra applies to our professional lives too, my professional life as well. I think the amount of change that we're experiencing will require growth on an order of magnitude that we have not experienced before. And I wanted to share with you that NAHQ is determined to grow. I am determined to grow, and we really want you growing with us. So I'll leave you one more time with the chant and put all sorts of good energy into the world. If you are unwilling to grow, no one can help you. But if you are determined to grow, no one can stop you. Let's be unstoppable together. I look forward to working with you all very soon. Thanks so much for everything, and we'll see you next time.